Okay, so I'd like to welcome everybody who's here today. My name is Randy Hyde. I'm the director of the Nancy Marks Cancer Wellness Center. We are a free cancer wellness center. We provide services to people with any cancer, be it exercise classes, discussion groups, short-term individual counseling services, an annual retreat, a 5K, which is our big fundraiser of the year, and it's a lot of fun. But we also provide educational programming such as this. The feeling at the Nancy Marks Cancer Wellness Center is that education is so important for women, especially that we deal with, that are there's so much information out there, and so many places are not giving it because they don't have the time in which to be able to allow you to really make very decided decisions. And this evening, so I'm going to just go back. So if anybody's interested in any of the services that we provide, or would like to speak with a licensed social worker to discuss any of your emotional concerns, oftentimes that happens after treatment, when things become very quiet, a lot of emotions start to bubble up, and oftentimes you don't know where to turn, but you are welcome to contact us. We could see you in person, on Zoom, on the telephone, and again, all of our programs and all of our services are for free. So what I'd like to do is turn the program over tonight to Nicole Rizzuto. She is let me just say it properly. She's a tattoo artist. She has many areas of expertise, and I think I'm going to allow you to really explain a little bit more of your background, how you became a tattoo artist, especially for women and their nipples and areolas. As far as I'm concerned, this is a blessing for women to be able to feel so much more whole if you so choose to go through with this procedure, for you to be able to take control. It's another area of your life that you're able to take control of and make that decision if you want to do it or not. But what I can tell you is I've seen Nicole's work, and it is just beautiful. It's just amazingly beautiful. I've seen it firsthand. And so I'm going to have you speak, Nicole. I'm going to introduce you, and please just fill us in on the beautiful work that you do. What we're going to do is Nicole's going to speak for a while, and then we're going to take questions at the end. Thank you again for being here.
Well, thank you so much, Randy, for having me. And hi, everyone. Thank you so much for joining. Hi. Some faces I know, most of you are new. And again, thank you so much for joining me today. So nipple tattooing. Who here, raise your hand just real quick. Who has a tattoo? Let me see your hands raised. Few. Okay. All right. Awesome. So you guys kind of know a little bit about tattooing. It's become very trendy and popular over the years. But when you are diagnosed with breast cancer, one of the last steps in your reconstruction is areola repigmentation or 3D nipple tattoos. The big thing that I want to kind of bring across today, and this is where me and Randy kind of really believe in the same thought, is giving you the information that isn't really out there that a lot of breast cancer survivors may not know. So fair warning, I'm going to do a little presentation because pictures are worth more than 1,000 words, right? I also have a little video of one of my own clients' personal experience with finding me and why she found me. So the topic today I want to discuss with all of you is the good, the bad, the ugly, and the solution. And this pertains to the mental and emotional impact that nipple tattooing has. So fair warning with this presentation I'm going to do, there are some images of mastectomies. There's great reconstruction, beautiful tattoos we're going to show, but there's also something that I want everyone to be aware of, and that is the bad nipples that are being performed and the impact that that has as well. So just like dealing with breast cancer or any cancer diagnosis, a lot of times we just see the happy things, the things wrapped with pink ribbon, but the reality is that there's a lot of bad things to it, and the solution is to be informed and to be aware of these things so we can stop the bad nipple tattoos from happening. So with that, we are going to do some screen share, and let's see, I'm going to jump right into that. Okay, and I'm going to put myself here. Awesome. Okay, so can everyone see this? Yeah, okay, good. So this is just a little slideshow that I prepared for everybody, because again, I sometimes can't always say it, but these photos, these tattoos speak for themselves. So again, the thing that I do is restorative nipple tattooing. So let's talk a little bit about that first. So tattoos can help us heal, or they can actually cause harm. Good tattoos, as we know, great areola tattoos, can help a survivor connect again to a body ravaged by breast cancer. Bad tattoos, if you've seen any kind of the tattoo shows, bad botched tattoos, scratcher tattoos, people getting cover-ups, there are bad tattoos. And this also includes restorative tattooing. A bad tattoo can have the opposite effect, leading to body dysmorphia, disorders, and depression. So a little bit about tattoo history. Otzi, the Iceman, was found in 1991 in the Ötztal Alps. He was 6,000 years old with 61 tattoos that actually had tattooing marks for acupuncture points. So they believe that they use tattooing as a form of medicinal purposes to relieve pain. The tattooing has been around for a very, very long time. Tattoos can be used for healing. Predating acupuncture by 4,500 years, ancient tattoo practices were seen as an effective way to alleviate pain. We know in many cultures, they were used as rites of passage, protection to display achievements, hierarchy, or a warrior's journey. These days, however, money seems to be the goal, and especially with the popularity of tattoos, we see that prominently. These values are being lost and survivors are being harmed. So when we think about the tattoo process, it's about healing that fracture. A realistic areola tattoo can help a woman feel like nothing has been taken from her. When she sees her reflection in the mirror, her mind relaxes, knowing all is well and nothing is wrong. The journey is over. Not saying this is going to happen with everyone, but this is the goal, especially with a well-done tattoo. And these are all of my work, just FYI. These are all 3D nipple areola tattoos done on flat skin. The good is that our vision is we want to think every survivor deserves great tattoos, as they should, just like they deserve the best reconstruction for their body, or the best surgeon, the best surgical team, the best treatment for them. Our goal is to help find these common mistakes, to avoid them, and to overcome them, meaning that sadly some people will not be able to have tattoos depending on, you know, bad radiation damage and things like that. So we want to make sure we have the best options for each person. But there is a growing problem, especially in my industry, with doing restorative tattoos. So the problem is bad tattoos being performed. No nipples is a daily reminder to someone of what she has lost, and it stays in the back of her mind as she goes through life. Having bad nipple tattoos even worsen the case. So here are some examples. This tattoo was done by a nurse, that it was tattooed too soon. We're going to talk about that. A body artist didn't really know the proper aftercare, and the tattoo actually stuck to clothing, caused this kind of scar formation. And PMU artists, PMU stands for permanent makeup. So PMU meaning they do brows, they do lips, they do eyeliners. It is very common that a lot of PMU artists are trying to do areola tattooing and don't really know fundamental body artwork and are scarring up women. And this is a great example of one. And again, fair warning, some of these photos are a bit graphic, but this is the reality. So why is it challenging? So the challenge is a couple of things. We're not tattooing normal, healthy skin. We're tattooing scar tissue, radiation, possible past necrosis. This is a challenge in itself when tattooing this type of skin. There's inconsistencies. We know that when we tattoo any kind of scars, there will be some kind of fading, and depending on how severe it is, it varies from person to person, as well as people's medical, conditions, how they heal. And on top of that, the one thing that's not being talked about or recognized, we are working on a trauma site. The area that you had surgery, the body remembers that trauma. So we could be stimulating trauma while we're tattooing you. And if someone's not trained properly how to triage that in a way, it could actually imprint more trauma, when in reality, we're trying to bring closure and wholeness to that. So it could actually have a snowball effect and go down a very dark path. So a little bit about who am I? Who am I to talk about all this stuff? Well, I started out as a traditional body tattoo artist. I did an apprenticeship starting in 2002 and did body art tattoos up into 2004, 5, and 6. I was diagnosed with kidney cancer at the age of 24. So that kind of put my tattooing career on hold, because I was inspired to help others and went into the operating room, and I became a certified surgical technologist. And I have been doing that for over 12 years, where I assist in the operating room. I've done general, ortho, neuro, pediatric, Da Vinci robots, oncology, and plastics, which includes mastectomies and reconstruction. So I have been part of all types of mastectomies, all types of reconstruction, including implants, explants, deep flaps, latissimus, flat closures as well. So I have not experienced losing my breasts and nipples, but from a medical side, I know exactly what the body has gone through and the trauma that it has gone through. And here's some photos of me in the OR. That's actually me doing a little bit of a total knee joint. Yeah, it's a good time. So as breast cancer survivors, we know that we have gone through some trauma. There has been tissue removed. There has been emotional trauma impacted to it. And on top of that, when we're thinking about tattooing, this changes the skin. This changes everything. Blood flow has been compromised. Sometimes people don't have the great healing. They have necrosis. They have damage from radiation. So all of these are challenges, and this is the reality of it. This is not just, a little flaw in the skin. There's a lot of layers of damage that occur. Luckily, with the different types of reconstruction, we can provide tattooing for both. Usually it'll be either someone has a nipple reconstruction, where they take skin from the surrounding area or grafted from a different part of the body and create a little nipple bump that still lacks color and definition and things like that to mimic a nipple. So tattooing is still required. Or to some women, as what they've told me, don't want to have that other surgery, 3D nipple tattoos is actually a great option, where we create the illusion and depth of a protrusion of a nipple. So again, here are some of my, all of these are my work. I never would plagiarize someone else's work, but these are all of my work. So this is great examples of completely flat skin or not going through a nipple graft, where you can see here we have pretty nice soft flat skin, and we create the illusion and depth of a nipple there with shadows, highlights. So you have to understand how to draw if you're going to tattoo it. If you can't draw a nipple, you can't tattoo it, obviously. Another great example here, where it's completely flat, right? There's no nipple graft, but with artistic ability, understanding casting light, shadows, highlights, it looks like you can actually pinch them there. It's pretty awesome. Another good example here. So this is someone who had a little nipple graft, that bump, that protrusion there, but still there's no color, there's no details, the Montgomery glands, those little bumps that we could have in the areola. All of that is missing. So tattooing is what kind of restores all that and brings that back. So when you look in the mirror, your eye sees it as something that should be there anatomically versus that something is not right here. Something is still missing. And that constant reminder of what you've gone through. Yeah, I love all these. These are so much fun. So nipple tattoos complete one's journey and can bring a sense of wholeness and femininity. So there's some magic that can happen that I can witness within my own clients when they come in, that sometimes they're a little hesitant or afraid for the next step. It means so much to so many. The tattoos represent a lot to women, where it could be someone's like a finish line, the cherry on the cake, or I can witness someone actually become empowered, like find that feminine divine within them and reconnect to their feminine energy. And with this woman, she actually saw I could do heart-shaped areolas, and she said, let's do it. It was actually such a beautiful moment to see her kind of open up and blossom and just kind of fall back in love with her body again. And I wanted to showcase it just through a little bit more artistic type of photography. And I mean, it shows through it. And her smile every time she talks about her nipples, it's just, that was such a beautiful moment to witness someone who's gone through so much emotionally and to kind of reclaim their body again. It's a different version of them, but it's a positive version of them. It's not something that was negative. It was just, it's always amazing to watch that occur. And I love it. That's one of the things that is just priceless to see, to someone who just turns around and says, I can look in the mirror again. And I know with the people who are here, you may be at different stages of your journey. So I'm not saying that, it definitely could happen to you. I have witnessed it many times. But this is where I'm really grateful that I'm here to talk to you about this, because as beautiful as these tattoos can be, people who are doing the tattoos are actually causing harm. And so this is where we go into we talked about the good, we're going to talk about the bad and the ugly. So I am starting to be known as a corrector. About 40% of the women who come to consult with me now are for prior tattoo corrections. And as a medical professional working in the operating room, there's one thing that is drilled into our head all the time, is if you see something, you say something. Meaning that if you see a wrong medication or the wrong site or something just in an error, you speak up and you say something without any fear of being scrutinized or whatever, and that's something that I brought into areola tattooing with that medical consciousness that I grew over the 12 years of working in the OR. And the one thing that I started seeing more than I thought were really bad tattoos being done, to the point of physical harm and trauma, new scar formation in the skin itself, done by professionals, done by medical personnel, done by so-called licensed permanent makeup artists. And on top of it, the trauma that it was causing the women, it was heartbreaking to me. So there was a point where I couldn't be quiet, and the thought of maybe speaking badly about doctors or nurses doing these tattoos, or highly, sought out artists for whatever reason, the prestige and all that, I couldn't stay quiet anymore. And I started speaking up about this. And I'm going to do that with you guys today, because if I could prevent anyone here from receiving a bad nipple tattoo and reduce a little bit of pain, I'm going to do that. But the first step is talking about it with you guys. So very commonly nowadays, as part of the whole reconstruction process, a doctor's office could offer the tattooing, which in the bigger picture, it seems pretty convenient and makes sense. Of course, women trust their doctors. If they say we can do the tattoo in-house, it's covered under insurance, it's with a doctor that you know. But the reality is that doctors don't know how to tattoo. And I hate to say that, because I've worked with some amazing surgeons and they are not professionals at tattooing. They are professionals at surgery and reconstruction. And there is a gap here. There's a fracture in this. So, and there's no other way of saying it. So the common practice is that a doctor can offer tattooing in-house. They may admit saying like, it's not my specialty, but we can do it as a convenience. And most women will, but the lack of fundamental tattoo training, meaning to even tattoo healthy skin, first off, to do an artistic design, to understand the depth, proper aftercare, different skin conditions, things that can alter a tattoo, is, not really needed for a doctor or nurse, because they are allowed to tattoo under their medical license. So they will buy a machine. A very common one is Nouveau Contour, which is meant for permanent makeup. It is not a machine meant for body art. And they use teeny tiny little needles in scar tissue. And this is one lady who came in and I helped correct her. And this was her surgeon attempting to tattoo. And you can see visible new scarring here. And even with my attempts, you can still see there was some more fading and scar tissue that was there. But from this to this, that's a better improvement. And here are some other examples of doctors and nurses attempting to tattoo. So again, this is causing more trauma. If you are hoping to see something that resembles a nipple and you're left with this in your skin, I mean, I get like choked up thinking about it, because I've had so many women cry in my chair and talk about how their relationships are on the verge of falling apart. They don't want to take off their top in front of their partner. And, when I've questioned, how did this happen? Because as a tattoo artist, my fundamental tattooing, I can't understand how this occurred in skin. So it's machines, tattoo machines or permanent makeup tattoo machines, not meant for scar tissue for body art. The thought of a bed of nails. So less trauma, more surface area. If you use teeny tiny little needles, meaning like 1 or 2 needles meant for cosmetic, which is fine, but not on scar tissue, you're going to cause more damage. The needle configurations that we like to use as tattoo artists are larger, more surface area, less trauma, can pack more pigment in the skin. And this is definitely just evident of teeny tiny needles going over and over and over the skin, new scar formation. You can see here, this white patchy area, that's all new scar formation. And again, nothing that resembles anything that would look like a nipple or areola. Another one here, this is a great example of all new scar formation, that they went too deep. So again, if you do not understand tattooing, someone just trying to use a tattoo machine, they're tattooing an area that's radiated skin, maybe thick scarring. They go over it once. Oh, it's not holding pigment. Let me go over it again and again and again and again and again until I see something in the skin. This is what happens. We are creating new scar tissue. And there is a point of no return when it comes to skin, that when skin is so thoroughly damaged from scar tissue that it could never hold pigment again. So sometimes when people come in to look for corrections or improve their tattoos, I can't help them because the damage has been pushed too far. Now, there are some great examples of where I can help people, where maybe they just had one session. Artistically, it doesn't look good, like this circle within a circle bullseye effect. Fading is a great, but we can make something look more like a 3D nipple. Those are usually pretty successful. So here's one again, done in the office, like a circle within a circle, a dark brown and a weird pink that doesn't match her color. And then from step by step, again, because we know fading is going to occur, we don't want to overwork the skin. So I usually do it in a two-step process to preserve the skin and to also artistically reach our goals with the 3D effect. And these are her healed results. Much better than these weird brown dots here. Same thing with unilateral. Unilateral is one of the hardest things to do. It's a challenge because you need to match as best as you can to the native nipple and areola. So this was a correction where I see they tried to do the same shape, but left a weird yellow pigment in the skin. That's the other thing, that I don't know these pigments that they use, but from what I've learned, a lot of them are permanent cosmetic pigments, which I don't know the ingredients, but I know a lot of them have more products that probably break down faster in the skin, leaving these weird undertones of oranges. Salmon is a popular color. It's just not artistically done well. So, but with her, we found more of a pink tone. We tried to cancel a lot of those yellow tones and match that native side and the nipple graft as well to look a little bit more similar. And again, a lot of these are done by not tattoo artists. A lot of the corrections, even like PMU, there's like a handful of those. Most of the corrections I'm getting are done by doctors. This one, this lady came in and told me that she had her tattoos done at the same time of her reconstruction implant surgery. So while she was still on the operating room table, as they were suturing her up, they did the tattoos. And I don't know what kind of device they did, but it looks like some weird stamp of pigment that they thought would implant properly. And these were her healed results. And all of these little dots were these weird pigmented scars. And this was her first session with me. She is going to come back. But again, big difference. And you should never tattoo anyone immediately or during a surgical procedure. The body has already been through enough trauma. You're creating a surface wound on top of the wound that you created through the mastectomy and reconstruction. You're just overloading the body and you're doomed for failure. Again, what retention is there? It's just mostly scarring with weird orange pigment. This one was probably the most severe case that I've seen, and we're gonna just hear a quick video of my client's story from her own words, because again, I have not lost my breasts. I've been diagnosed with cancer, so I understand that side, but I don't know what it feels like to lose my nipples. And I don't know what it feels like to be botched with nipple tattoos. So this was the result of a doctor and then a esthetician trying to tattoo this woman's skin. It left no pigmentation. It actually caused atrophic scarring, a loss of cellular tissue in her skin, and this is permanent damage. This is the most severe I've ever seen. And because this was done by a doctor and an esthetician, to me, this is complete negligence. And I want you guys to just listen real quick to her story because it is a beautiful one, and we'll just take a moment.
I've been on my journey for almost 12 years now. I was diagnosed when I was 32, required a double mastectomy, reconstruction, chemo, all the fun stuff. And as I was going through the process, unfortunately at the time, I don't think doctors knew what to do with me because I was so young. I didn't know all of my options. I didn't know all the options for reconstruction. So I kind of just went with what the plastic surgeon suggested, that I'd get the best results. I had the reconstruction done at the same time as the mastectomy with the tissue expanders. I've had 2 rounds of implants because the first implants, there was an issue after 5 years. But I also had nipple reconstruction where they took a graft to recreate nipples. At one point, I wish I had never done that because he went in and he did tattoo. And he handed me a book of swatches and said, pick which one you like. And I'm not artistic, not creative, and I'm being handed a bunch of skin swatches and pick your color and not knowing what complements my skin. I picked a color that I thought was okay. It really wasn't. He just, within less than 5 minutes, he went in and did both really quick and they faded. Didn't look great. And I got up the courage a few years later to go and have it done again in the same office, but with somebody, being an esthetician and there was advertisements, I thought more experienced. But no, I knew something was wrong when I'm having multiple tattoos all over my body. I know what it feels like to be tattooed and it almost felt like they were digging a hole. So it was quite intense and it didn't, because of that, there was certainly a lot of trauma. It didn't heal right. And it looked like now not only did I not have nipples, it just looked like I had big round scars on my chest. It's been a bit painful. No one ever, keep my shirt on at all times, make sure everything's well hidden. So tattoos are hard. It's not anybody can do it. It was just disappointing because it was destroyed. So not only did it look bad, I felt like everything was just destroyed because I could tell that, oh boy, I'm gonna have big issues. Because if you saw what it looked like, the trauma, you could see it. I came home and my husband was like, holy shit. You better, this could get infected. This is just not good. I mean, the healing it was brutal. And I'm not a quick healer. So it was just disappointing. And I just threw in the towel and said, okay, well, we'll just always make sure they're covered. Because I follow all the cancer groups and all on Instagram and by some algorithm, I guess, because I follow breast cancer and I follow tattoo artists. I started seeing that there were people who specialize, that there are artists that specialize in this. And I was going to make a trip. I found one artist, I think she's down south somewhere. It was very hard to find. And I was planning on, do I take a trip? Do I say, because her work looks great. And I was willing to see if anyone could help. And then I just happened to somehow find you on Instagram and I looked at the work. I'm like, oh my gosh, Belmore, I can do this. It's right here. And I figured at this point, they couldn't look any worse. But I had for a long time, I wish I never got the nipples done at all. I would have been happy. I thought, why didn't I just go to my tattoo artist to get flowers or something? This is just ridiculous. But not all tattoo artists want to do that either.
Talk a little bit about your experience.
Well, let's see.
And I love the result. Decision away from me because it shouldn't be me. I found it very calming, reassuring. Clearly, just all the details and the aftercare. You know what you're doing, and I just felt comfortable. And I love the results.
If you could tell other survivors who are planning to get their nipple tattoos done, what would you tell them?
Do your homework, do your research. And, I think you're in such a the problem is you're so vulnerable at that point. And the plastic surgeons, generally do a great job with what they know, but tattooing is a different specialty. But because I think I was so vulnerable and just going through just an overall traumatic experience, I just went with whatever they told me to do versus doing more research. And I think it's doing more research. Ask about the training, like what kind of tattoo? Let me see pictures of your previous work. And if you're comfortable, if he shows pictures of his previous work, and if you feel like the fact that he handed me the swatch and told me to pick should have been my biggest red flag, versus he should have been making recommendations and talking to me about, how it's going to look and symmetry, like none of that happens. So I think doing your homework and, really looking at examples, asking, ask what training they took.
Yeah. So that was one of my clients who has probably the most severe damage I've ever seen. And she was grateful enough to allow me to share her story because it is so traumatizing. And, some women don't want to relive that, even though it can be empowering to others and to be informative. Some people just want to get these tattoos done and move on. So with that, with the medical field, we need to start raising standards on behalf of survivors because they deserve it. A poorly done areola tattoo can ruin the aesthetic of a good reconstruction. And I've seen some beautiful reconstruction. And I always take a mental note of like, who is your surgeon? You know, like they are perfecting the surgery to a point where I'm just in awe. So let's also give them the best nipple tattoo they can have. So doctors know this, and the concept of working with an artistic professional should become standard practice. The one thing is that, you know, tattoo artists, we still have a stigma of, you know, we're seen as like the bad person in the movies or, you know, the little misfits and stuff. But most of us are just really creative, artistic people who are so passionate about what we do. And we know that tattoos have a healing benefit. So the mental health impact, right? The body has an unstoppable ability to repair itself. As we all know, if anyone's have any kind of surgery, the body is going to heal itself, but the mind tends to hold on to pain and trauma. And there was a UK survey done by one of the ART artists who did a survey of UK breast cancer survivors, those who've gotten their NHS or healthcare, national healthcare provided tattoos done by artists or by nurses versus a professional tattoo artist. And 85% of women were unhappy with their tattoo that was done by a nurse or NHS or healthcare provider. 85%. So that's 85% more people harmed that could have been avoided. So things with mental health that can impact with a bad tattoo: more negative body dysmorphia, depression, divorces, and much more. I have had many women tell me about their intimacy issues with not taking their shirt off, not even having, you know, sex with their partner, or they're single and they are avoiding dating, that they are being held back, and that is inhibiting them from experiencing all their life that they could have. With my client in the video, she avoided gyms and made sure she was always covered in the locker rooms, making sure they don't wear bathing suits in case their bathing suit slips. They don't want anyone to see it. There is a huge disconnect, even more so with one's body, when in reality, when we try to have the reconstruction, we're trying to restore you back to the best that we can. And we're doing a disservice. And to me, I consider this malpractice. We had one, again, in the UK study, one woman stated that she showers with her bra on because the tattoo was so damaging to her when she looked in the mirror. She couldn't even look at herself in the shower. So tattoo artists are not the problem. And it's really easy to see how we can make things better. Number one, for those in like the permanent makeup world who have their hand in areola tattooing, you need longer tattoo training, meaning not just a quick online course or a 2-day in-person course on how to do brows and also how to do areolas. That should not be accepted at all whatsoever. Longer foundational tattoo training, meaning some type of apprenticeship or mentorship for at least 6 months or longer. My apprenticeship was a year. And that was before I was even able to tattoo and skin. I tattooed a lot of bananas and oranges and grapefruits before I ever tattooed skin. And I had to learn how to draw. Again, if you can't draw it, you can't tattoo it. Prerequisites prior to medical training, meaning that, you know, if doctors and nurses, we're not saying they can't do this work, they completely can. But again, they need to have other prerequisites, like a fundamental type of tattooing training, and not just buy a machine and run havoc. It's not acceptable anymore. Eliminating online only certificates. So this is one thing when clients come in to talk to me, they say, oh, well, I went to someone and they had all these certificates on the wall. I'm like, those hold no weight. And were they online only? The big trend now, especially with the PMU world, it's beauty based, meaning it's about how you look on the outside and the filters and the pretty stuff and money and making more money. This is not the type of work that world needs to be in. We also want to empower survivors to know all their options when choosing a tattoo provider. So that also means connecting with surgeons and medical facilities, because they're going to be the ones who are going to be the front line to tell the survivor what the options are, because they are the ones who are guiding them through this entire process first. We usually come in at the end. And more often than not, I hear women say, I had no idea I can go to a tattoo artist. So, and again, in the PMU field, we can't trust them for the leadership. Not for this work. Why? Because they've also had every chance establishing high standards and regulations. Things like the SPCP, which is Society of Permanent Makeup. I'm not even a part of it, but they have these societies which have been established for 30 years, and they have not set standards or regulations for areola tattooing. If a cosmetologist requires 18 months of school, why would someone who is breaking skin not even need 18 days, let alone the common standard of only 5 days, which is what is common when someone wants to learn how to do areola tattooing through permanent makeup industries? So it comes down to love. Always, love is always the answer. Because at the end of the day, I love the art of tattooing, and I want to use that love to help others. I know the power of a great tattoo and the danger of a bad tattoo. I'm responsible for the quality of my work. Don't think people should be working on trauma sites that don't have that basic love and respect. Doctors and nurses don't even love tattooing enough to learn it. Most PMU tattooists don't even like tattoos enough to get one. So that's kind of the strange thing that's not spoken. Like, do you even have a tattoo and you're doing tattoos? What are you doing, guy? So we like to keep it simple. Those who know how to tattoo knows what it takes to do the work well. And these are one of my clients where I was lucky enough to do her nipple and a beautiful scar cover up, because even though she had a beautiful nipple tattoo, that scar reminded her. So on top of it, we can also cover that up. And she had this beautiful moment of reconnecting with her body again. So the question is, why aren't those basic standards kind of implemented when doing this type of work? We know the impact on mental health, how we're allowing this to continue. The solution is simple. It's important to do. Raise the standards. So that includes, I'll stop sharing. That includes standards of demanding it from your providers, your medical providers, asking questions that if you are going to have your tattoo performed at your doctor's office, which is completely fine, are they a licensed tattoo artist? Ask to see photos, ask about their training. It is not offensive to ask this. And when clients of mine come and said, yeah, I did ask about to see photos, and they got so offended, like, well, that's a red flag. No one should be offended to ask to see their work. You know, just the same as when a doctor may show you during a consultation the before and afters of a reconstruction, implant reconstruction, or a latissimus flap, photos of examples. The tattoo should be the same. And not just fresh tattoos, heel tattoos. That's the true tell of a good tattoo. So I know that was a lot and not that it's all negative, but this is where the information gets started, is we have to speak the truth. And I have been doing a lot of advocacy work to trying to get that for information out there to the breast cancer community, because I want to stop seeing bad nipple tattoos. I want to get just more primary tattoos and ready tattoos, and not try to just see that trauma being proliferated. We've come so far in the surgical world to improve reconstruction. We can do this as well. And tattooing belongs to the tattooists. Medical people can get their proper training, but if they know and cannot dedicate the time as tattoo artists, let us do the job for them. And I guess with that, I'll open up the floor to questions.
Thank you. First of all, thank you, Nicole. Your passion comes through. The passion of wanting so much to help women mentally as well as physically, physiologically, is tremendous. So yeah, let's open up the floor to questions. And no questions silly or, going to be frowned upon.
No. The only silly question is the not question asked,
That's right.
as my teacher always told me, and I never asked anyway.
I have a question. So my reconstructive surgeon said that they do offer that. I don't, so how much training, I know you went over this, but I'm still a little iffy, like how much training should she have? And I know I want to see some pictures, but how many pictures would be good to see? And and like I guess how far out is good. I'm 2 years out from my deep flap, 1 year out from my revision. So my next step would be the 3D nipple tattoos. And one of my breasts is a line, and one still has some exposed, the belly underneath it. So they're not even anyway. So what are the things I really should drill in to have confidence in?
Yeah, so this will go for anyone who's going into that next step of preparing for your tattoo. So for the tattoo provider, are they a tattoo artist? Or are they just a nurse in the office that does it out of a convenience? If they say, no, it's one of our nurses and we sent her away for training. Okay, where? How long was the training? So commonly, again, they'll send them to permanent makeup trainers who offer areola tattooing, and maybe it's a 2-day, 3-day, 4-day, 5-day course. I don't know about you, but what doctor learned how to do anything in 5 days? What hairstylist who cuts hair learned how to do anything in 5 days? We are implanting pigment into skin, and this isn't normal skin, this is scar tissue. There needs to be at least some type of fundamental tattoo training. So it's some type of apprenticeship, a minimum of 6 months. And a lot more commonly now, doctors are hiring tattoo artists to come into the office. So that's how I got started. I was hired by a plastic surgery group to do only their nipple areola tattoos for their patients. So they saw that their tattoos weren't good and they wanted to improve, which is kind of becoming the trend, which is a great trend. So ask, are they a licensed tattoo artist, or is it just a staff that you sent out for training? Again, I'm trying not to bash specific names, but I know Sloan Kettering is a hospital that sent a couple of PAs for some 5-day training. And, sadly, I'm still getting a lot of corrections from them. So again, they're not dedicating their entire practice just to do tattooing. They're working in the OR, they're seeing patients, they're charting, they're doing all this stuff. This is an artistry and it needs that dedication to it. Another thing is, again, ask for photos. Ask for healed results, not just fresh. So when talking about fresh tattoos versus healed tattoos, that pigment is sitting on top of the epidermis layer, right? And in the dermis layer. When we're healing, that epidermis layer will flake off and the new cells will occur. So the real true tell of a good tattoo is that healed result, and see how much pigment has healed and stayed properly in the skin. And visual trauma, excessive scarring will be visible during that healed photo. So only fresh tattoos, to me, is a red flag. And any professional tattoo artist will have healed photos as well. So they'll have step-by-step, like first, second, like in my photos, you see first, second, but I also showcase healed. So that's really the true tell. Ask about the aftercare. So there are a couple of things. No bacitracin or neosporin should be put on a fresh tattoo. No gauze should be put on a tattoo. You don't want anything that is absorbable put on a tattoo. That woman that we saw the video, they put gauze and bacitracin and stuck it on the tattoo. And that's another reason why she had so much trauma to it. You should have non-absorbable dressings like a Tegaderm or a Telfa, and keep that tattoo dry. You don't want to put a lot of product on it because extra moisture can draw bacteria and causes a lot of irritation to a tattoo. So make sure they go over the tattoo instructions. And if there are things that seem a little questionable, don't be afraid to ask questions. Again, if you've had body art tattoos and you're like, well, I've had a tattoo and this isn't how my tattoo artist does it, why are you different? Question it. And then say, if you don't feel comfortable, I always tell all my clients, follow your intuition. I can't give you the answer, only you know what the right answer is for you. But if you feel like something is wrong or off, then ask, well, what are my alternatives? Can I see a tattoo artist? Can I, outside of the practice, were you guys ever thinking of getting one in the office, which would be even great and convenient? But don't be afraid to ask. And again, like my one lady said, they were so offended that I asked for it. Well, then I would just walk right out. That's like a
Right, so,
red flag.
so we have another question.
Sure.
How soon, what was it? How long after reconstruction should one consider nipple tattooing?
Yeah, so with this type of tattooing, there's no specific box, right? We all heal differently. We're going to have different complications. A good guide, from what I tell people, when you're at least 6 months out is when you can think about booking a consultation, because you need to have that artist evaluate your skin. So even though your doctor has said you're approved for a tattoo at 3 months, you're not. If you see redness in your scars, pinkness in your scars, that scar is not fully bonded and safe to tattoo over yet. You can actually open up all that scar tissue and cause new trauma. You want scars to look more on the purpley to white. Usually that's at a year mark, but I like people to come in at 6 months. I go over everything, instructions, aftercare, and I evaluate the skin. If I see things where massaging can help, lymphatic drainage massaging, if there's some excess fluid buildup, if there's some adhesions, I would recommend some massaging as well. You know, and then depending, again, people have necrosis, people have issues with some reconstruction, they need a little bit more longer time to heal. Then I'll kind of push it off and say, let's reevaluate you in another 3 to 4 months, start the massaging, start some skin products that can help, and we'll take it from there. But again, with my clients, it's always going to be safety to tattoo over that area. Because if you tattoo it too soon, you have a risk of tearing up that skin to the point of that's permanent damage. And you can prevent any type of pigment holding in that skin ever again. And on top of it,
Okay.
we're dealing with implants, we're dealing with reconstruction. If you get an infection there, that's a big problem. You know, so safety is number one. So I would say 6 months just to start thinking about it, but it may not be at that 6-month mark. Everyone will be a little different.
Okay, next question. Is this covered under insurance?
So the Women's Health Cancer Act of 1998 states anything pertaining to breast reconstruction, including nipple tattoos, should be covered. Now, for me, I'm considered an out-of-network provider. I do have an MPI and all of my information set up that I can give you a claim to submit on your own for reimbursement. But because I'm an out-of-network provider, you would pay me as you would any body art tattoo, but we can try to get you back some money. It's not always guaranteed. So usually I tell women, call up your insurance, see what your out-of-network benefits are. Everyone's insurance plan is going to be a little different. Some people have great out-of-network, some people don't. But just so you can kind of get an idea ahead of time of what your reimbursement might be, it's going to be different from plan to plan. But yes, you can get reimbursement. So if you get it done by a doctor's office, they'll just kind of take care of it as any visit. They do pre-authorization, all that. I, as a tattoo artist, don't have that capability.
Okay. Make sure.
Okay, how long, thank you so much. And how long does the nipple tattoo last?
So these are permanent tattoos. These it's another misconception that I think could be money marketing based, which is foul. So done properly, these are permanent body art tattoos. There will be some fading, as all body art tattoos do fade over time. In 10, 15 years down the line, I tell people, you know, some of the details may soften, it may lighten, and you want to touch up just like any body art tattoo. That's understandable, but these are permanent forever in your skin. When you see results like some of the photos I've shown you, it's either poor quality tattooing techniques, or I don't know what kind of inks they were using. And usually it's the application of not putting it in properly into the skin where you see that fading occur. Again, this where it comes down to understanding how to do fundamental tattooing and understanding scar tissue. But these are permanent tattoos, just like any body art tattoo.
Okay. As an artist, do you design the nipple areola tattoo? Would pre-surgery pictures of my breast help or not?
Yeah, so it depends on the client, what they like to do. It's a mixed bag. Some women come in with photos of their native nipple and areola, and that's great for color reference. But some women, they said, like, I used to breastfeed, my nipples were gross and big and brown. I don't want those. I want cute little pink ones. So we could do whatever you would like as a design. My job is to make sure that it looks anatomically correct to the new breast that we are tattooing, where I don't want to go too big or too small. I am very cautious about the color saturation, so I always go a little light, not too dark, right? Because we can always make a tattoo darker and bigger. I can't do the opposite. But I will kind of guide you in what would look appropriate best to your skin tone and your breast reconstruction. But we could try to match as best as we can to your native, or we can start whole brand new.
Okay, and this is from Dorothy Forte from the Manhasset Women's Coalition Against Breast Cancer. She wrote, I'm so happy to have met you through the Zoom, Nicole, not only for myself, but for others I come across in my work. Thank you for a thoroughly, clearly stated presentation.
Oh, thank you. Thank you so much.
And then Stephanie wrote, what about Medicare?
Yeah, so for me, with my experience, Medicare, Medicaid usually deny me because I am a tattoo artist. So if I was a doctor or a nurse, I might get something in return, but it's usually a minimal amount. So another dirty secret that's out there is that when doctors do the tattoos, they can charge a lot more than any body artist ever would. I'm talking $2,000, $5,000. I've heard $8,000 for one tattoo session because they can, and they have overhead and they have a business to run as well. It's still a business, but they will submit a claim for a $5,000 tattoo that they've done. That doesn't mean they get that price. So I know Medicare, Medicaid's like, oh, okay, here's $250. We don't care. We don't care what you want it to be. It's $250. And that's from Medicare, Medicaid. When it comes to me with my clients, I usually get denial, and I try to fight. I send appeals in, and still it's like, nope, they're very strict, but that's just how it works.
So what I'm going to do is post an organization, another organization that we work closely with, and that's called Sharsheret. And what they do is they can give money towards nipple tattooing. They have people who can work with you to see if your income is at a place where you will be accepted, and they will be able to help you. So far, anybody I've referred to them has been able to receive some funding to be able to work towards this. The goal of all of the cancer organizations is that the cancer survivors have the best experience and the best outcomes. And that's really why we all work so closely together. So here is the link to Sharsheret. Wait, let me just see. Okay, there it is.
Mhm.
And then and hopefully, you know, they should be able to help. They also help if you know anybody going through cancer treatment. They also help with funding cold caps and some other things that make women feel, you know, better about themselves. So is there any other questions?
Yeah, I wanted to answer one here. There was a question, what is the infection rate? Which
Oh.
is a good question. And can insulin-dependent diabetics do this? And do you do eyebrows? That's a good one. And then also, do you do eyebrows? So infection rate, luckily, knock on wood, my infection rate is 0. But with anything like surgery, you always have that risk. That's why consultations are good. That's another thing. Don't ever do a same-day tattoo without a consultation. Red flag. So with the consultation, I go over your medical history, talk about the aftercare to properly take care of the tattoo. Now, of course, things like with radiation, lymphedema, all these other comorbidities can put you at a higher risk for infection. Sometimes, if you've had multiple infections after a surgery, prophylactic antibiotic would be needed prior to a tattoo, but that's where you and your doctor would talk about that beforehand. Diabetics can get tattooed, but of course there is a higher chance of delayed wound healing. Sometimes there is some type of neuropathy, so making sure that you're paying attention to the tattoo, because sometimes you scratch yourself, you don't realize, and you could have an infection and you don't feel it, especially after surgery too, you lose some sensation. So paying attention to that, being more diligent about that, I'm going to drill into your head. But you can get tattooed with insulin dependent diabetes. Again, I would just always make sure, open a line of communication, talk to your doctor, general doctor, whoever, that you're going to be getting a tattoo, and to follow up with them. Yes, I also do eyebrows, not microblading though. There's more information on my website. And then also a lot of the questions about pricing, Medicare, Medicaid, a charity that I just got involved with, and I'll put their link in the chat. It's called Mastectomy Tattooing Alliance. It's a UK-based charity that now just turned international, and I am the first US tattoo artist to be part of their charity. So if you're struggling financially, low income, lost your insurance, you can also apply for areola-funded tattooing through the Mastectomy Tattooing Alliance, which is I am a part of. If you want my website, I will post that as well. It has more information about the charity. Also, all my full gallery. I have great Q&A or FAQs about tattooing, and stuff about eyebrows too. The
Those
fun
are
thing, like
important.
eyebrows. Yeah, well, that's why I started doing, because most of the clients, chemo, and they're like, "Do you do anything here?" I'm like, "Girl, I got you." So yeah, eyebrows are also there. It's an option.
Where are you located, Nicole?
So I'm located in Belmore, New York. So that's Nassau County, South Shore area, kind of by Massapequa, Freeport, Merrick area. Nice, cute little area. I'm 10 minutes from the Belmore train station on the Long Island Railroad if you're coming in from the city. And I have a private studio. There's no other tattoo artist there. No one kind of gawking like, "What are you getting, honey?" None of that's very private, very relaxed, one-on-one setting. So, and people who come in for consultations can bring a support person, partner, whatever they would like. There's no restrictions with COVID and things like in that anymore too. I know that was a big question and a big detriment. Like a lot of women who've had their surgery during COVID, they couldn't have like their partners there, their family members there. Like that was so heartbreaking too. So no, I embrace like, no, if you want someone there, like to be supportive that you couldn't have during your surgery, no, I welcome that wholeheartedly.
Right. Linda, you wanted to ask a question?
In addition to nipple tattooing, do you do, I saw beautiful design tattoos on breast. Do you do that as well?
Yes. So I do scar cover up or body art tattoos also for mastectomy clients. Yeah. So some women don't want nipples, some want beautiful florals. So yeah, definitely consult like that too.
Yeah, mine is at least 15 years out. So I'm at the point of maybe deciding on something different since I have other tattoos.
Yeah. Okay. Yeah.
And you have that on your website.
I do. Yes.
Thank you.
So Nicole, there are some women who choose not to do implants or do not have reconstruction. So
Mhm.
you are able to also do that beautiful work on somebody who's not had a breast-like formation after surgery.
Right. So aesthetic flat closure, I think is what you're mentioning. So, and that's becoming more and more popular nowadays. And people ask about flat closure and nipple areola tattoos. So that's the thing where you can get nipple and areola tattoos on flat closure, but it looks more masculine, to be honest. So the idea of body art, decorative art to kind of cover the scars or just, again, reclaim your body, have that whole experience is a beautiful option as well, which is what I also offer.
That's great. Anybody else before we come to an end? Okay. Well, I do want to thank you all for taking the time this evening to come and listen to Nicole. As was stated, a great presentation, the good, the bad, and the ugly. And so if any of you are going forward with either thinking about having this tattooing done, I'm going to say, reach out to Nicole, ask questions. If you have that before you even make the step to go to have a tattoo done. And if you do it, know that you'll be in really good hands because her work has been beautiful. I follow her on Instagram and the outcomes are just amazing. They're just terrific.
Can I
So
just
thank
do,
you for your time.
oh, thank you.
Yeah,
Can I just do one more thing? Because I don't know if it's okay, but Judy, if you just want to say a little something, because I have one of my awesome clients here. And just to share your experience real quick. If you can, she's like, where's the mute button? Let's see.
Okay. Yeah, so I followed Nicole for a while and on Instagram and finally got cleared after multiple surgeries and to have tattoos done. And yes, she showed my pictures today and they're wonderful. Her studio is warm and comfortable. You feel loved while you're getting worked on. Your comfort is utmost. I am currently in treatment. So I had to get cleared by my oncologist to get worked on in between treatments, and Nicole was great. She was wonderful. I look in the mirror and I feel more like me than I was before I did it. It's definitely life-changing and the way you feel about yourself. So she's wonderful. I figured I showed Randy.
Yep.
And here we are.
Yep. Beautiful,
So-
beautiful. That's why I said I saw her in person and I've seen online. And you feel like there's a 3-dimension to this, which is really terrific.
Yeah.
So, yes, Nancy, you had a question? Oh, okay. Yeah, so it can be life changing on some level. I don't think people realize it. Just the same thing as a good reconstruction, right? You have a good reconstruction, you feel so much more comfortable within your body. And that's not to say that if somebody decides not to have any reconstruction, that you can't feel beautiful on the outside as well as on the inside. So it's all very individual, very unique to each individual. But if in fact you choose to do something like this, we always want to go with the best doctors, we want to go with the best tattooists, and we want to, really make sure that everything is checked off and completed. So we're out of time, but again, if anybody is interested in finding out more about the Nancy Marks Cancer Wellness Center, please feel free to reach out to me. We do have another program in March. Flyers will be going out. We're going to be having Dr. Michelle Loy, who is an integrative medicine doctor. She's going to be talking about plant-forward diet and how we can include lots of plants with all different phytonutrients to get healthy and well. So just keep an eye out for that. And that will be another Zoom next month. So with that, I wish you all a good night. I hope that we don't have snow that's going to interfere with anybody's life, and stay warm, and we'll see you next time. Thanks
Okay.
again.
Thanks, Randy. Great job.
Thank you. Great job.
Thanks,
Nicole.
Dorothy.
Thank you. Bye, everyone.
You're a
Bye-bye.
lovely, lovely person. And thank you for sharing. It really felt heartfelt and wonderful hearing you speak so beautifully. Thank you again. Thank you.
Thank you so much for your time.
Bye-bye.
Appreciate it.